Hi, I'm Lindsay Mayer. This is my story on how I survived breast implant illness. I will share my journey with you and I'll give advice. We'll talk about breast implant illness and symptoms, letting go of shame and perfection, preparing for surgery and recovery. Follow me on this journey.
Hi everyone, welcome to week 2 of navigating your explant surgery. Just to quickly tell you that I used to have a very sporty spice kind of body. I was into gymnastics and swimming, and I had, I would say, a nice B cup going on. My breasts were small and firm, and I was very happy with my body. I was athletic. And here's a picture with my dad and I on the diving board before I had children and before life took a hold of my body and gave it one of these. Anyways, then I got pregnant, and you can see I was like a boat setting sail. Huge. The good thing is I had healthy boys. I had healthy kids, and I was ginormica. Then I got married. I still look pretty good. I had two boys, and then I got married. So you can see in this picture here, I was still looking good. I was firm, and yeah, that was a good time for my body. I had 2 more babies after that, and yeah, then things started to go south. My body changed drastically. I breastfed them. I had pancakes for breasts anyways that you could fold, and it was not pretty. So, anyways, life stuff happened. I ended up having a divorce, and then I went through a period of hating my body and not liking my life, and things kind of went extreme. And I met somebody who wanted me to look like I used to when I was 16, 19, whatever, not 40, having four babies. So that the realization is you can change your body now. You can get Botox, you can get a lift, you can get implants, you can have a procedure on your face to scrape off the top level, Botox, lifts, tucks. I did decide to go and have implants done. So I needed to start planning, and this is what you need to do too. This is what we're going to talk about, preparing for explant surgery. Started to phone around different plastic surgeons because they mostly were doing implants, but slowly they're starting to do more explants as they're realizing there's a lot of money and pain in trying to gouge as much money as possible out of terrified women that know that they're physically suffering because of these implants. So I started to phone around, and then I found out that mine had been recalled. My implants were the natural textured implants. They were the ones causing anaplastic large cell lymphoma, or BIALCL. This company is now under a multi-district litigation for failing to inform patients of the risks associated with breast implants. So do your homework, ladies, and find out what kind of implants you have. That's number 1. Then you need to find your surgeon, and you need to find a qualified surgeon, not one that's going to gaslight you and tell you you're going to be depressed if you get them out. You might be mutilated if you get them out. Ladies, you want to get them out. You're sick, you're not feeling well. Do you want to be mutilated, or do you want to be alive? I'm not saying you're going to be mutilated, but you find the right surgeon, you'll be just fine. You have to accept the fact that your body's going to change. And for me, it took a long time for me to accept the fact that I was going to have to go back to what I was, and I was embarrassed. There was a lot of shame involved in having implants, because for me anyways, maybe not for you, but I was embarrassed that I'd done that to my body. Anyways, you want to find the right surgeon to do this. You need to have an en bloc or a capsulectomy. So you want to get the one surgeon that's highly skilled to remove the surrounding scar tissue, which holds the toxins, heavy metals, platinum, silicone infection, and bacteria, all around your implants. Doesn't that sound lovely, ladies? We put all that in our body, and then all these microorganisms and weird things are growing and infecting our bodies the whole time. So this is really important to recovering from explant surgery, is getting the whole capsule that surrounds the implant. So your body forms this capsule and it's trying to protect the rest of your body from this foreign object. So this is where all the good, gross things start harboring in there and growing, and definitely not good, but the bad stuff, this is what you want to get out. Find your surgeon. Unfortunately, there's a huge money grab in removing them now. I went all over to find the right surgeon for me, from the Cleveland clinics to Seattle to Montreal to Newport Beach, which, by the way, Newport Beach, no, they're so expensive. And they're all about the Botox, the big Barbie boobs, the money. There's a lot of money in Newport Beach. So at the time when I was trying to find where I was going to get them out, they were 18,000 American. What? And imagine that in Canadian dollars, because I'm in Canada. So anyways, I did some consults with a bunch of surgeons. They were at the time around $300 each. And of course that went towards your explant if you decided to go with them. If you didn't go with them, you were paying the money and that was it. So nothing's for free going on out there. You gotta really look into who you want to do this. I did interview 4 of them and I ended up going with one. One, obviously, the best for me. Okay, so you need to find the best for you. I was a high risk patient, so I really needed somebody that knew their stuff. You don't want somebody whipping them out in the office in an hour. They need the ability to perform an en bloc and a capsulectomy. So if you have health problems, you need to start getting them in check right now. Your body needs to be ready. You need to do lots of walking. You nourish your body with lots of greens and fruits. You need to get good sleep, and you need to cut way back on the alcohol, ladies. I know you know who I'm talking about here. Me, especially, I definitely overdo it, and it hurts my body, and I needed to really get that in check, especially before I was going into surgery. By the time I talked to my surgeon and I had it done, it was 2 months. I was on it. We put everything on our credit card. $15,000 later, still paying it off now. You can find a way to do it because you found a way to get them in, so you got to find a way to get them out. This was including hotels, flight, renting a car, and then the surgery itself was 8,000 American at the time. I can guarantee you it's way more expensive now, just because people are realizing there's more money in getting them out than getting them in. Okay, so start interviewing, start getting your body ready, and then I'm going to touch base in 1 week, and I'm going to tell you a list of preparation materials to do, and also how my surgery went, day 1. So I will talk to you in a week. Bye for now.